depends on obviously how many teeth we move and how severe the misalignments are. The treatment can take between 6 months and 1 year, but usually we finish the treatment much earlier than about 6 months, a year ago. Patients used to change the aligners every 2 weeks, but now we ask patients just to change it once a week, and that speed up the process. And also with the Invisalign did a lots of research into it, and with the help of the smart force attachments, the treatments are more predictable and much quicker. But usually some patients see the changes already after 2 weeks. Pain is a strong word. I would not use painful, but definitely you might feel some tenderness, some pressure, but that usually lasts 1 day or 2 days. And obviously it's because the teeth that needs to be moved are pushed to the certain position. But usually, no, I would say no pain. I never had any patient that said, oh, it was so painful, we had to take painkillers. And usually, if you fit the first aligner, usually the pressure lasts just overnight. Patient usually says the day after, we felt nothing. Of course it does. I mean, depends on if a patient has an overbite, underbite. Sometimes the teeth can push the lips forward, and obviously once we push the teeth back and retract it, then we get a nice lip position. Then yes, it can change, but it's always for good. So we always not look at the teeth themselves, we look at the face generally, we look at the bite, which is important, and also we look at the lip support, everything. But if you imagine a patient with the tooth that's obviously sticking out and pushing the lips forward, and once we push it back, the lips is more harmony with the whole face. But yes, it can change your smile. Invisalign usually depends on obviously how many aligners you need, and depends on how long the treatment will go. So it can start from 2,500 upwards to 4,800, 5,000, depends on how severe the cases are. Average, I would say between 3,000 and 4,000. By good maintenance and wearing the retainers, they can last lifetime. I would always say to the patient when I see them first that you need to be really committed to have a lifetime retainers in some kind of art, any retainers. Otherwise, our teeth can move back. So, and even we know these days that our teeth always moving. So, and our face changes when we age as well. So a proper retainer and patients who maintain it right, see the dentist regularly, I think they can last lifetime. Every patient is for me a success story. I always get excited with every patient. I remember just a very young girl that she never smiled, and she was quite a shy person. And once we finished the treatment, she changed her job. And I could see that she smiled more. She said every time when she wakes up and look at the mirror, she's smiling. And even her friends told her, you smile more than before. Because before she was kind of hiding her teeth. So she didn't want to show anyone. And last week, actually, I saw her and she got engaged and getting married. So I think to see a person, personality, how it changed, with just moving some few teeth around and give them more confidence, it's quite nice to see, actually. Yes, but I think each person's journey is a successful journey. Without exaggerating, all of patients I see after Invisalign, they just said, we wish we did it earlier. And that's, I'm hearing it from each patient.